Welcome to our tour of BC Children's Hospital. We hope it'll help you prepare for your child's heart operation. Located on Oak Street in Vancouver, BC Children's Hospital is just a short drive from Vancouver International Airport. There are a number of places to stay quite close to the hospital, including the Easter Seals House, which is within walking distance. These accommodations can be a home away from home while your child is undergoing medical treatment in Vancouver. Try connecting to the Family Support webpage if you want to find practical information on places to stay, what to bring, and how to find your way around. When you enter the BC Children's main entrance, you'll see an information desk where you can ask for help finding your way around the hospital. You'll also see a coffee shop called Second Cup. Your child's care will include visits to the pre-admission clinic, surgical daycare unit, radiology, and the Children's Heart Center, among other areas in the hospital. Your child's care begins a day or two before the operation with a visit to the pre-admission clinic. You'll meet members of the healthcare team that will look after your child during his or her operation. This includes your child's surgeon, nurses, a nurse practitioner, a child life specialist, and an anesthesiologist, sometimes called the sleepy doctor. They'll gather important information to prepare for your child's operation. In the pre-admission clinic, the nurse practitioner will ask you questions about your child's health. A pre-admission clinic nurse will check your child's height and weight. Your child's anesthesiologist will explain how your child will be put to sleep for the operation. Your child's surgeon will review the details of the operation, and a cardiology clinic nurse will also explain what to expect after the surgery. A child life specialist will use play and age-appropriate explanations to help your child and you know what to expect. The entire healthcare team is there to answer your questions. As part of this pre-admission visit, your child will have an echo and electrocardiogram at the Children's Heart Center across from the pre-admission clinic. Your child will also have a blood test at the lab on the second floor. And your child will have a chest x-ray at the radiology unit on the main floor close to the surgical daycare unit. A cardiology clinic nurse will show you where these areas of the hospital are and more. The entire pre-admission visit may take 4 to 5 hours. On the day of the operation, your child will check in at the surgical daycare unit. This is where your child will prepare for the operation. Your child will be seen by nurses and the anesthesiologist. Wait times before the operation are hard to predict, so come ready to play in the meantime. The child life specialist can help you with that too. When ready, a nurse will take your child to the operating room. For children over 3 years old, a child life specialist may also accompany them into the operating room. Once your child has entered the operating room, you'll be given a pager and taken to the ICU waiting room. You can wait there until the operation is finished or get something to eat, go for a walk, or get a coffee on or off site. When the operation is over, the surgeon will meet you in the ICU waiting room and will explain how the operation went. Your child will be moved to the Pediatric Intensive Care Unit, sometimes called the PICU or just ICU, to begin recovery from the operation. You'll need to call from the phone in the hallway to enter. Washing your hands before entering and when leaving the ICU helps keep your child and others in the unit safe. Your child may be drowsy when he or she wakes up from the operation and will have more than one IV line, monitoring lines, and drainage tubes. Once stable, your child will be taken to the Children's Heart Unit to continue recovering. The Heart Unit is located on Unit 3M on the 3rd floor. Every patient room has space for a parent cot so you can stay with your child overnight. Outside of your room, you may also want to spend time on the outdoor patio or the parent lounge. A social worker is available to provide emotional support and, if it applies, help you assess financial assistance from your home hospital. The unit also has a playroom and a teen lounge. A child life specialist is available on the unit to play and talk with your child. Games and toys can also be brought to your child's bedside. You can find something to eat at the cafeteria or one of the on-site coffee shops, including Tim Hortons, Second Cup, and Starbucks. You can also go grocery shopping at Safeway, which is within walking distance from the hospital. If you're looking for more information about your child's health or about the hospital, try connecting with the Family Support and Resource Center. You can find information online or call, email, or drop by for help. When the doctor decides your child is ready and you've learned how to care for your child after the operation, you'll be discharged from the Children's Heart Unit to your home away from home in Vancouver. A few days later, your child will have an appointment at the Children's Heart Centre for a post-operative checkup. If all is well, you and your family can head home, approximately 4 to 7 days after you were discharged. We look forward to welcoming you to BC Children's Hospital and wish you and your child all the very best. If you have any questions, be in touch with your regular cardiology nurse or specialist.